my job in part is to maximize the information that you have so that you are informed about this project as it moves forward. The Senior Deputy for Health, Advocacy, and Services is Yolanda Vera. She's my point person on matters related to health.
The new hospital that we're going to be talking about, I guess I can't, is a 120-bed community hospital. It'll have an emergency room and an operating theater. It'll provide ancillary services. And the services that are going to be provided at this hospital will be coordinated with the other healthcare services that are being provided currently by other public and private providers. And we expect to substantially complete construction by late 2012. So next slide, please. You've read in the paper and should know that this new facility is going to be innovative. It's going to be run by a nonprofit 501c3 board. Half of the members appointed by UC, half of the members appointed by the Board of Supervisors. It will be an independent board, and to be appointed to the board, we want board members who have demonstrated substantial experience of at least 10 years running top quality health facilities. They will manage this facility with discretion, including having the ability to hire the staff that will be at the new institution. Next slide. UC will provide, select and supervise the physicians, approximately 20 physicians who will be the staff at the hospital, and they will have an accountable system of peer review so that we can ensure that we're maintaining top quality care. Next slide. And this hospital, we believe it will be a catalyst for changing and revitalizing the entire surrounding community. And one of the things we want to talk to you about is how this hospital is part of a master plan that we developed for the 38-acre campus. We want to hear your thoughts. We recognize that hospitals are engines for economic development, and that this investment creates an opportunity for this community to reinvigorate the surrounding community, not only the 38 acres that make up this campus, but the surrounding 100 acres. So we're taking on an approach. We want to be strategic. We want to leverage the assets that we have, the employees that we have, the buildings that we have, the fact that we have so many public institutions and we have a lot of goodwill and momentum that we've created. And we want to create more jobs for the community. And it also involve some workforce training as well too. So we believe that this impetus and this effort that you are now part of, and we thank you for spending your evening with us, is all about job creation. We're going to talk some about workforce preparation. We want to promote healthier lifestyles in the community. We want to empower the community, and part of this meeting is the first of many to hear your thoughts on what we should be thinking about as we develop the campus. And we're going to keep an eye on federal health reform to ensure that what's happening in DC strengthens and is aligned with what we need to happen here within the community. Next slide. Okay, now I want to talk briefly about the components of building a healthier community within this area, just to be sure that it's understood that this hospital is a key leg of a stool to build a healthier community, but it's a part of it. Next slide. What we want to start doing is creating a more integrated health delivery network within all of South Los Angeles and in the surrounding area. And right now, that involves both public providers that are currently there and private providers. Among the public providers, well, we've talked a little bit about this new hospital. And this new hospital has 120 beds. It's also going to be providing some outpatient services, about 40,000 outpatient visits a year. And that's going to be for patients who are inpatients who might need follow-up care after surgery, outpatient surgeries, among other things. We also are going to be creating a new multi-service ambulatory care center. You're going to be hearing about that. Right now, our multi-service ambulatory care center, our MACC, provides about 180,000 patient visits a year. We want to maintain those visits. We need to coordinate the care that's provided at the MACC with this new hospital. We're going to be creating a new health center on this campus. Right now there is a health center that is outdated, and it is over near the corner of 102nd and Compton, where it's about 19,000 square feet. We're going to build an expanded health center here on the campus, about 30,000 square feet. That's going to provide public health services, treatment of communicable diseases, TB-related services. And we're going to start building that as well. We also have many surrounding private health partners in the area that we need to figure out how can we work with them as we create a new health facility here. Among them are our free and low-cost community clinics. Right now, the county contracts with about 10 agencies or so to provide services, about 40,000 visits at 20 sites. They provide free and low-cost clinic services. Some of you are here, St. John's. We also have private hospitals in the area, St. Francis, Centinela, and we need to figure out how can we coordinate this hospital services with those services. We want to be sure that you understand, a multi-service ambulatory care center, which is currently here on the campus and is going to continue to be here on the campus in a newer facility. It provides walk-in services. It's people who walk in, get treated for urgent care, outpatient specialty care services. Right now, our MACC serves the entire county and provides specialty care services throughout. So that's what's meant by MACC, okay? And this new MACC is going to continue to provide specialty outpatient services. Earlier this year, the supervisor asked the Urban Land Institute to start to develop a concept paper on a master plan for the 100 acres surrounding this community. And they came up with the concept of 3 zones for projects on and around the campus. And here you have some of those projects that are listed of things that we'd like to set in motion. And they include great improvements on a metro station area plan that's moving forward so that this area will be a place where all 3 lines come together, and it'll be a transportation center, which will make it attractive both for people who want to go shopping, people who want to come to work, and we think it'll help this community. We're creating right now with you a master plan for the campus. We've talked about the South Health Clinic. We would like to create a health career training academy where we can train local community members and workers who are here who want to move up and improve their health careers. And here's some of our timelines. We're on a schedule, and the supervisor is beating the drum. You'll notice that many of these projects were underway. The board has committed significant dollars. The Metro Station plan is a cost of $4 million. That is underway, and those improvements. The Medical Campus Master Plan, we're starting that process of getting your input. South Health Clinic, the start date where they've leveled the ground, but the construction is expected to start in March of 2010. The Health Career Training Academy, we're working on that now, but hope to announce some good news to you soon. The new inpatient tower, construction is expected to begin 2010. The new MACC, construction 2010. And Humphrey Health Center is underway. Willowbrook and the fitness park to be determined. We also really want to emphasize that a key component, even though it's not immediately in the area, is our sister hospital towards Long Beach, the Harbor, a UCLA center. The board recently announced significant investment on improving that campus. It's about 72 acres. It's also in the supervisor's district. It includes retrofitting, which is a $51 million commitment, and then redoing the surgery emergency room, and that's already initiated as well too. That's $323 million. So we have many new investments, very serious about revitalizing this area, and it includes, as I mentioned, some of the capital investments. We hope that in turn attracts private capital and philanthropic dollars, and it already has. And we want to develop an exciting master plan with you. So I believe that's, The last basic slide.